And I was going to quote the wonderful job your dad did when he came to Wyoming in 1963, but in the absence of time, we'll say. Well, thank you so much for all being here. I appreciate the testimony from the panel today regarding funding for Indian programs for the upcoming fiscal year. Admiral Buchanan, I'd like to begin with you, if I may. As you know, I've worked on legislation with members of this entire committee for the last several years to ensure the Indian Health Service had the tools it needs to improve access to quality of health care and facilities. 1 month ago, April 8th, Chairman Hoven and Senator Thune and I sent a letter to Director Wiaki and Secretary Azar requesting the Indian Health Service answer some basic questions. One was how the agency manages staff and employment records, how background checks are completed to ensure patients are safe, and how the Indian Health Service addresses allegations of provider misconduct, because that's certainly been in the news. So their questions our staff first posed to the agency in February. And I'm going to submit for the record a copy of that letter. I'd urge you to prioritize a response to our letter because it addresses some of the key failures that have placed human health and basic human safety at risk in the past. So I know I speak for all of us when I say I want to work with you to ensure that catastrophic failures in patient care do not continue. I'd like to give you a chance to respond.
Thank you, Senator Barrasso, and for your leadership to this committee. We have prioritized that letter and the responses, and I can assure you, I was hopeful to have that letter with me today, but it's currently under departmental review, so we will make it a priority.
Thank you. And